Welcome to Something to Talk About from the Bainbridge Island Senior Community Center. I'm happy to have you here. I'm Reed Price, and Brynn Felix with the Peninsula Community Health Services is with us. We're going to talk a little bit about healthcare on Bainbridge Island and across Kitsap County, and state funding that is making it possible to move forward on a PCHS primary clinic primary care clinic here on Bainbridge. Before we get going, though, I like to acknowledge that we are meeting on the ancestral homeland of the people of the clear salt water, the Squab, the Suquamish people who have lived on the waters of the Saley Sea since time immemorial. We are grateful for their stewardship, and we are learning from it so that we too can be better stewards of our lands and waters. Also, Fieldstone Communities of Bainbridge Island is a sponsor of Something to Talk About. They offer independent living, assisted living, and memory care. Their Bainbridge location is up on Rolling Bay, and you can take a tour and they'll treat you to a meal. Call 206-594-1010. Ask for Celia or Jamie. That's 206-594-1010, or call or check out the website, which is fieldstonecommunities.com. Brynn, you're Chief Corporate Affairs and Legal Officer of the Peninsula Community Health Services.
Yes, I know
That's a mouthful. PCHS. And I was noticing in the review last week that there was a major benefit for PCHS and for our community in the just concluded state legislative session. Tell me a little bit about what that is and what that means for those of us who might be looking for primary care support on Bainbridge.
Sure. So the great news, it was a very difficult budget, and the governor's still reviewing. But in terms of the capital budget, Peninsula Community Health Services received an allocation of $556,000 to finish construction of a primary care clinic that PCHS owns and is located in the Winslow Green complex. So we purchased, I believe, in 2023. All of our permits are ready to go, and we just needed a little bit of more capital funding to help with the final stretch of completion. So with this money, we are able to start building. I think we're already working on it right now. Started this week, and we're hoping to finish it by the end of the year for opening next year. And I'm happy to chat about the services as well.
Yeah. Yeah, I'm interested in that. I also, I think that I understand that the facility is perfectly suitable for the work, so it should be a relatively straightforward remodel or retrofit to make it work for you.
Yes, it was an optometrist's office before. So it's not going to be wholesale redesign or anything like that. But we are going to have 4 exam rooms as well as 1 procedure room. It's going to be a medical and behavioral health clinic. So we will have 2 medical primary care providers as well as 2 behavioral health providers and about 8 support staff. And we anticipate being able to serve about 2,500 Bainbridge Island residents annually at the clinic.
That's amazing. It's definitely needed. I know that when Swedish decided to stop providing services here, a number of people who are active at the Senior Community Center were directly affected and trying to figure out how to find primary care close by, because transportation gets more difficult as you get a little older, and it's nice to have some medical support close in. And I know that there's kind of different levels. I know there's been a lot of talk about the work that's being done by the Virginia Mason Franciscan group about a hospital expansion, but your focus is more on that first level of care, right?
Yes, we're focusing on primary care, which is really, we think, the backbone of the healthcare system, the hospital addressing more acute needs.
And it seems as though, one of the challenges when you don't have primary care is that you end up with more pressure on acute services. And so having this available is wonderful. When you decided to move into Bainbridge, what kinds of decisions did you have to make? What kinds of research did you do to figure out that this was a good fit for PCHS?
Sure. Well, really, the community approached PCHS in 2021 as Swedish was closing. At the time, Multicare, I think, had been exploring the possibility of creating primary care on the island, and then it didn't work out for that agency. So PCHS has been looking around for an opportunity to fill that primary care need gap on the island since then. We had explored another property that ended up just not really working out, not the facility was not quite to what we needed for our functionality. And then the Winslow Green property opened, and we were able to close that deal rather quickly, which was thrilling. And it went through the stages of permitting and again, now we're at that point of construction. So in terms of considerations, when a community approaches Peninsula Community Health to fill a need gap, our mandate from our board of directors is, let's figure out how to do it. And so it all worked out timing wise. It was the right price point and the right time. We were able to use our reserves to purchase for back in 2023.
Can you tell me a little bit about the mission of PCHS? What kinds, you mentioned it sort of, the idea of responding when you're asked. What kinds of communities are you seeking to serve
Sure. Yeah, great question. So PCHS is what we call a federally qualified health center. So it is a creature of federal statute. It was a community clinic before, and then I think there actually are some people on this call who helped turn it into a federally qualified health center. And that means that we have the federal mandate of serving everyone who walks through our doors, regardless of their insurance status or their ability to pay. So PCHS, right now, our payer breakdown is we serve about a third of commercial patients, about 20% Medicare patients, a little over 43% Medicaid patients, and the rest are private uninsured. But really, we serve as the safety net. So if folks are unable to, again, don't have insurance or are underinsured, we find that a lot of the time we serve them regardless of where they are. And PCHS in the last several years has been called upon multiple times as providers have been forced to close their doors to fill those gaps. So for example, the Kitsap Children's Clinic, which had been open for several decades and was just a wonderful clinic, had to close its doors and called up PCHS. And we coordinated with them and hired a lot of their providers. We did not acquire the entity, but we worked closely with them. And so as they closed their doors, we were able to then open up a pediatric clinic in Silverdale to try to fill that gap in the exact same spot. So taking on their providers, taking on whichever patients of theirs wanted. Similar story happened with a pediatric dental practice in Bremerton. Had to close its doors because it was not a financially viable model. So PCHS opened a pediatric dental clinic on the same site. Really, our goal is to fill gaps that exist in the primary care continuum. And so just a little bit about our services. I mentioned that on Bainbridge Island, our services are going to be medical and behavioral health. PCHS also, this will be our 31st or potentially 32nd site, depending on when our other dental clinic is completed in Bremerton. But we offer dental as well at other locations and pharmacy as well. So we offer a full suite of fully integrated primary care services, as well as support services. And Reed, you'd mentioned transportation challenges. Another aspect of being a federally qualified health center is that we provide free transportation and language access services. So one of the things that we strive to do is eliminate the barriers that prevent people from accessing care. It's not just making sure that it's there and available, but it's really reducing those barriers to receiving care.
To get that far.
And one other piece of our program that I'll mention is we also have 10 mobile medical clinics, or mobile clinics, that includes mobile medical, mobile dental. We have 2 mobile dentals, which are pretty cool. And one of them has 3 full dental chairs inside. Mobile behavioral health, and we are just now starting to get online a mobile mammography clinic. So a big piece of what we do is helping bring care directly to folks who otherwise might have difficulty calling up and making an appointment and going to a traditional clinic. So
That's wonderful. That's one,
multiple.
one of the things that we're in the very early stages of trying to imagine an expanded senior community center here. It's going to take a few years to raise the money, but one of the things that we've thought about in our planning is to make sure that there's a space for mobile services to be able to easily, set up right adjacent to a community center.
That's wonderful.
You were talking about you were saying that you have dental services. Are you indicating that that would be part of what might happen at this clinic?
No, not on Bainbridge, not at this particular clinic. We have some standalone dental clinics. We do have a couple of clinics that have both medical and dental clinics, but this one on Bainbridge Island, which will be one of our smaller clinics, will be just medical and behavioral health.
And I know that there's a lot of pressure for support for behavioral health and mental health services here. So that's a wonderful part of the offering that you're going to have, ideally before the end of the year or early next year.
Yes.
Yeah, you mentioned mobile dental clinics. I think that you have some support as close as Paulsbo. Is that right? For folks?
For dental clinics? Yes. So our closest dental clinic to Bainbridge Island would be the Fishline Clinic, or the clinic that co-locates with Fishline in North Kitsap and Paulsbo. We also have a medical clinic in Paulsbo and one in Kingston as well. So when Swedish did close, and you were talking about other folks trying to figure out where they're going to get care, some headed towards Seattle, some were able to get into Virginia Mason, and we have about 1,000 Bainbridge Islanders who receive care off of the island between our Kingston and our Paulsville clinics as well.
And before we got talking, you were telling me a little bit about some of the other programs that are in the works for PCHS. Can you elaborate on that for us now?
Sure, I'd love to. We're in a really dynamic time with our organization. So in addition to building this clinic on Bainbridge Island, we are also going to be building a dental clinic, our Spinnaker Clinic, which is going to be off of Kitsap Way in Bremerton. We also received some capital money in the budget for the dental clinic as well. We are currently building a medical respite facility in downtown Bremerton. That will be a 22-bed facility that enables people who are experiencing homelessness and who are discharged from the hospital to be able to have a safe place to recuperate for up to 30 days. So, imagine that right now, if you are in the hospital, you no longer are in acute status, but it's not safe to discharge you to the street. It might not even be safe to discharge you to a shelter because you might need wound care or some other clinical supports that a shelter still isn't able to provide. That's the function of a medical respite. So you have a place to safely recuperate. That one we plan to complete by next spring as well. And also in Bremerton, just a couple of blocks away, we are going to be building a meal center that is going to have a commercial kitchen. It's going to be a place where we prepare the meals for the medical respite. We will be bagging food. We give away a lot of free food at our traditional clinics and our school-based health clinics. And so that will be the hub of our school program. And then separately, I think I made a mention to you that we will be purchasing by the end of the year 3 reentry houses, which will be permanent supportive housing aimed at people who are exiting incarceration to help have set people up for success as they're transitioning back into the community. And one house will be in Port Orchard, one will be in Paulsbo, and one will be in Silverdale. So close to our clinics.
And what's the geographical area that PCHS serves?
Our service area includes Kitsap, part of Mason, and rural Pierce County. So we've got clinics all the way up and down Kitsap County, from Bainbridge down to Port Orchard. In Mason County, we have clinics in Belfair and Shelton. And in rural Pierce, that's the Key Peninsula area. So we kind of say our part of Pierce County on our side of the Tacoma Narrows Bridge.
Yeah, gotcha. In this time of federal tumult, what are the biggest risks that PCHS sees to your operations, from federal support?
Well, I mean, everybody's looking at what the Medicaid cuts might be. And it's hard. There have been so many different numbers that have been thrown around. I'll start by addressing the state budget, because even if we didn't have this federal landscape going on, our immediate challenge was with the state budget, facing a $14 billion deficit. We knew there were going to be cuts to healthcare, and we weren't sure how. And so this session, we really prioritized maintaining the adult Medicaid dental benefit, which at various points was on and off the table for cuts. Same with the managed care pharmacy benefit. And so while some providers did see cuts to Medicaid, the federally qualified health centers were able to just basically try to hold the line. With federal cuts, we don't know what that is going to look like. I think the legislature also is not sure what the impact of the federal cuts will be, and they might have to go back into a special session based on what the federal cuts look like. So, I wish I had the crystal ball to say exactly what would be impacting, because then we could start, mitigating risk right now. We just know that, pieces of the Medicaid program, with major cuts will trickle down. We're not entirely
Oh, for sure. And with your mandate that you see probably a disproportionate number of people who are on Apple Care.
Yes, quite a few, like 43% or so are Medicaid patients. And we are one of the largest Medicaid managed care providers in our particular region. But we will continue to serve and continue to see people. We'll just, I think, depending on what the cuts are going to look like, we might have to scale back certain programs, hours of operations, things like that. We're kind of looking at what are our different options depending on the gravity of the cuts.
I know that we talked a little while ago with a group that's trying to explore the idea of a hospital district, not to build another hospital, but to supply funding through taxation for a variety of the kinds of clinics and services that are the front line.
The Alliance for Equitable Healthcare's public
Yes.
hospital district. Yes.
Yeah. You're obviously following that. Would that from PCHS's point of view offer some support for the kind of work you do?
PCHS certainly, as a large stakeholder in our local healthcare ecosystem, is paying attention. We attend many of the meetings and give input along with other healthcare providers. We are not officially weighing in with a position. In general, our position is more access is better. We recognize that there is a healthcare access crisis. There's no disagreement about that. The crisis is so widespread. It's primary care, it's specialty care, it's long-term OBGYN. There's so many facets of access issues that it'll be interesting to see which approach the public hospital district will take, because there are that amount of money that would be allocated will make a difference, wherever it's going. The question is, where is it going to go? There's so many places, there's so many areas of need, and the baseline infrastructure of our healthcare system is very, very fragile right now.
Yes, I mean, it's true all over the country, but I do know that our region, there's been a lot of concern about that, and your expansion comes at a good time involving, I know for personal experience about the risks of that kind of respite care of somebody who doesn't really have good discharge opportunities. They can't go somewhere where they'll be safe out of the hospital, and the pressure to get them out of the hospital is very high because of the the fact that the hospitals are not really long-term care facilities.
Yeah. And I think one other piece I'll mention, last I heard, the public hospital district was looking at behavioral health potentially as an area to address that need. And just to give a little bit of an overview, PCHS is a licensed behavioral health agency, but we are what we call low to moderate. We address low to moderate behavioral health complexity. And as people scale toward higher level acuity, then we refer to agencies like Kids Mental Health Services. And so behavioral health is very much a continuum. And I'm not sure which part of that continuum the public hospital district might be addressing, but there's need throughout. And I was really excited to hear that the Suquamish tribe will be building a detox facility too. That's
Oh,
wonderful.
great,
And
great.
very, very needed.
Yeah, and my understanding from talking with the folks from the Alliance was that the goal is to actually survey and review what the needs are, that the idea isn't to pre-plan sort of what the response could be. And one of the other advantages of not building a facility, but being a distributor of support money, is that you can be a little more flexible based on health trends in our region.
Yes, yes, they're taking a very flexible approach and doing a really deep dive into um, different reports that have come up recently about needs assessments countywide. Yeah, they're certainly doing their homework.
Well, thank you for taking that little circuitous route. We hadn't talked about them, but
Oh, no.
are there any other things you want to make sure that we mention today? I mean, the big thing that caught my eye was the Bainbridge Clinic, because that's been on so many people's minds for the last few years. So I'm glad you were able to make that work.
Oh, yes, us too. I would like to take the opportunity to just thank our lawmakers for really making this happen. If we had not received the allocation, we would have had to push, at least another year before we could open the clinic and finish the renovations. And then the other part that I think is really relevant for this particular audience is that Peninsula Community Health Services is the primary agency that has the lead contract to help anyone who needs to enroll in both Apple Health, so through the Navigator contract. They don't have to be a patient, and they can call it PCHS and help navigate to enroll in Apple Health Medicaid. And also, PCHS is the lead agency that works with the Office of the Insurance Commissioner to help people enroll in Medicare. And again, you do not need to be a PCHS patient in order to receive assistance in helping navigate Medicare enrollment, which I mean, I'm a lawyer in healthcare, and I find it really intimidating sometimes to figure out how to navigate all of the insurance bureaucracy. But we have specially trained teams that help folks navigate those systems and figure out what the best plan is for them.
Yes, thank you very much for mentioning that. We have a couple of state health insurance benefit advisors trained and work through you. And they are here at the center on Thursdays to help people either as they're just beginning to figure out what's going to happen with Medicare, or on an annual basis to review what their insurance plans are and whether they're on the right plan for the pharmaceuticals they're taking. And it's easy. We ask people to register through Helpline House for the appointments here at the Senior Community Center. But yes, I'd forgotten that PCHS is the overriding organization that helps make that happen.
Great. Yeah, and just really want to emphasize, you don't have to be a patient. You can maintain your primary care provider elsewhere. We're just here to help and make sure that folks get the best plan that works for them. Yeah, and the last thing I'll say is thank you so much for having us. We're excited to talk about our clinic and our other endeavors, and just really excited to open our very first clinic on Bainbridge Island.
Yes, we're glad to hear about that. And thanks for stopping by, and feel free to, if there's something else that's going on that you think we ought to know about, just let me know. I'm happy to talk to you in the future. So
Great.
have a good afternoon, Brynn. And
You too.